Well, serving its patients or focusing on profits. There are accusations of staffing and patient care dropping while profits rise. We're talking about a leading-edge Silicon Valley hospital, Good Samaritan, Good Sam, in San Jose.
Investigative reporter Candace Nguyen first broke the story of lawmakers sounding the alarm on Monday and then a medical group pulling their patients from Good Sam earlier today. Candace joins us now with how deep those problems run.
Good Samaritan started as a pillar in healthcare here in the South Bay. Now it's an example of some of the most dire healthcare and health cost problems nationwide, nurses and experts say. From flies inside the ICU and maggots in a patient's nose to dangerously low staffing levels in the labor and delivery unit.
That's not safe.
To losing its county COVID vaccine allocation, to a broken elevator nearly leaving an airlifted patient stuck on its roof. Nurses have been complaining about Good Samaritan Hospital for months.
Make some noise!
Prompting our investigative unit to track complaints and violations at the hospital, finding out how the once premier Silicon Valley facility fell from grace, as nurses Diana Rossman and Christina Wang say.
Oh, it's scary some days going into work.
They would just expect us to take as many patients as we could handle.
State records show Good Samaritan has had more than double the number of complaints than the state average for at least the past 3 years. This complaint, substantiated by state inspectors, describes a patient laying on a bedpan for 6 hours. This lawsuit accuses the hospital of losing a body because another body was stacked on top of it. Good Sam settled the case, saying the body was later located after a failure to follow storage protocol.
Just nothing surprises me at this point.
The Centers for Medicare and Medicaid Services rate hospitals on their overall performance. Good Samaritan has a 2 out of 5-star rating,
which is pretty well below average.
Would you go to a hospital with that rating?
I would be hesitant to.
Christopher Whaley is a researcher with the nonprofit RAND Corporation. He and his team released a report last year looking at healthcare prices for 3,000 hospitals. They found, despite its problems, Good Sam's healthcare costs sit above the national average, which is not surprising, he says, given its parent company, HCA Healthcare.
HCA is one of the, if not the largest hospital systems in the country. So when hospitals get bigger, prices go up and quality of care either doesn't get any better or in some cases gets worse.
It's become intolerable.
It wasn't always like this, nurses tell us. In 1965, Good Samaritan opened its doors to the South Bay, initially funded by the church. It operated as a nonprofit for decades, until 1996, when HCA acquired it. That's when things started going south, Rossman says, with staffing and safety issues reaching a boiling point during the pandemic.
And I had a patient that was pregnant with COVID, and I was stuck in that room for over 3 hours, trying to get somebody's attention so I could get supplies that I needed. I mean, I was afraid for her life.
Meanwhile, HCA's stock about doubled during the pandemic. According to a letter from 3 lawmakers we told you about earlier this week, HCA reported $3.7 billion in profits last year. Wang says she feels misled.
Like recently, they used COVID as an excuse and saying, oh, we've lost so much, money that we have to constrain.
So what's the hospital saying? Our team reached out to Good Samaritan's executive team but did not get a response. HCA declined our interview requests and instead sent a statement saying in part, the nursing staffing shortage is a difficult challenge for hospitals throughout the U.S. We're doing everything in our power to recruit new nurses. We self-reported some instances this spring when we experienced a lack of nurse staff availability, but these were corrected quickly. Wang and Rossman say they're reaching their limits.
I've really considered leaving.
They feel the business side of healthcare at Good Sam is getting in the way of the main mission.
Human lives, you have to draw a line somewhere.
Multiple nurses tell us state health inspectors have been investigating this hospital as recently as this week. HCA confirms inspectors have been here but did not specify why.
And our patients' lives in danger. We have breaking news tonight involving one of the biggest names in Bay Area healthcare. Good evening. Our investigative team just confirmed that Good Samaritan Hospital has received a serious penalty from federal regulators. This comes after the investigative unit, and specifically reporter Candace Wynn, exposed staffing violations just weeks ago. Candace joins us now with more on her report.
Yeah, Good Samaritan Hospital has been issued a finding that it's in what's called immediate jeopardy. And Jess, this is the most serious deficiency a hospital can receive from this federal agency. Good Sam confirms the Centers for Medicare and Medicaid Services notified them of the finding late Monday. Immediate jeopardy means there is or was a situation at Good Sam where the hospital's failure to follow regulations put patients at risk for serious injury, harm, even death. The hospital says, quote, there's been no demonstrated harm to patients. An internal email we got tonight from the hospital CEO to employees shows this immediate jeopardy status puts Good Sam at risk of losing its Medicare contract.
Well, ICU patients put at risk, untrained emergency staff, failure by hospital leadership. Our investigative unit has obtained a scathing report by federal regulators against Good Samaritan Hospital in San Jose.
Only on NBC Bay Area, investigative reporter Candace Wynn explains why regulators now say Good Sam repeatedly put patients in harm's way.
We have been requesting this report for weeks after sources on the inside leaked information about it to us. Good Samaritan and regulators have not released it, but we've obtained a copy from a hospital source. This report reveals failures by management to address serious, systemic, and reoccurring problems. More than 60 pages of deficiencies cited at Good Samaritan Hospital in San Jose coming to light for the first time. The prominent South Bay healthcare facility now dealing with pages of violations by regulators with the Centers for Medicare and Medicaid Services, also known as CMS. CMS conducted its inspection in June. Among the findings, an emergency department nurse saying she did not have proper training, staff failing to properly administer medication for intensive care patients, including a person suffering from an aneurysm and another taking fentanyl, the hospital failing to provide unexpired supplies and inspect emergency crash carts, and Good Sam nurses missing critical patient checkups in at least 11 instances, citing staffing shortages and not enough time. In two specific cases, regulators said there wasn't any formal re-education of staff about mentally vulnerable patients. Last year, 2 harmed themselves because one was inappropriately discharged and another was left alone in the bathroom. How serious is a notice like this?
It can be very serious.
Dr. Cheryl Damberg is a health services researcher at the nonprofit RAND Corporation.
Anytime a hospital gets one of these notices, I think consumers should be concerned that the institution is not working to maintain the standards that the federal government has set forth.
These concerns, we're now learning, point directly at hospital leadership. CMS wrote Good Sam's governing body, which includes their CEO and chief medical officer, failed to fully address serious, systemic, and reoccurring issues, placing 13 out of the 37 sampled patients at risk. In a statement to the investigative unit Monday, an HCA healthcare spokesperson wrote, "We addressed every issue noted by CMS, and we are ensuring Good Samaritan is in full compliance. We have full confidence we will meet the CMS requirements and retain our Medicare status."
If the hospital is found to not have remedied the problem, CMS can terminate the hospital.
Can a hospital survive without a contract with Medicare?
It would be difficult in most cases.
HCA and Good Sam detailed a plan of correction in the report, which we've posted on NBCBayArea.com. CMS is still reviewing that plan. This month, we also told you HCA agreed to recruit 80 new nurses and create 43 new nursing positions for 2 of its San Jose hospitals, including Good Samaritan.
Well, our investigative unit has uncovered allegations of bodies being misplaced and even lost altogether at hospitals. Families say it has added more heartbreak to the misery of losing a loved one. Our investigative unit, Candace Wynn, has been leading investigations into a well-known South Bay hospital for months, and she joins us now with what she's found.
In February 2018, Dana Vanosta's mother passed away at Good Samaritan Hospital.
My mom was an amazing lady. She loved Everybody loved her.
1 month later, Jillian Monteleone says she was nearly 6 months along when her pregnancy suddenly ended.
This was a baby we wanted and we had tried for.
Venosta and Monteleone say what happened to their mother and unborn child was no one's fault. But what happened to their bodies afterwards was different. Good Samaritan staff, they say, lost them.
What happened was so horrific.
Venosta is prohibited from talking about specifics as part of her settlement of her lawsuit against Good Sam in 2019. We told you about the suit in June when we first exposed reports of dangerous staffing levels and poor patient care at the facility. Venosta's complaint alleges her mother's body went missing at the hospital because another body was stacked on top of it for days. The facility and its parent company, HCA Healthcare, tell us staff failed to follow storage protocols and the error was corrected.
You lose someone as important as a mom. You try to find peace. And sorry. I mean, they just took that.
They ended up calling me back and saying, we're sorry, but the hospital cannot find the body. They threw the body out.
They threw the body out?
Yeah. She said it was just labeled tissue on my chart.
Even though Monteleone says she and her husband made specific arrangements with the hospital that a mortuary would pick up her baby for cremation and be placed in this urn.
How could it be labeled tissue? I was 6 months pregnant. I have a sonogram, of the baby sucking his thumb.
Good Samaritan isn't the only HCA-owned hospital accused of mishandling bodies. HCA owns a second facility in San Jose, Regional Medical Center. Like Good Sam, Regional holds a low 2-star hospital quality rating with the Centers for Medicare and Medicaid Services. State violations show in 2019, inspectors cited Regional Medical Center for failure to provide considerate, respectful care to 2 separate patients. This failure resulted in one of its patients' remains being held at a local mortuary for 298 days, and another patient's remains being held in the hospital morgue for 108 days.
So one, if they could hold on to remains for that long, how could they not hold on to my babies?
Monteleone's experience was at Good Sam, not at Regional, but she feels HCA is responsible. A hospital spokesperson sent us a statement saying, "We should have been more proactive. We are sincerely sorry."
How could you just not value life? It's awful.
Sadly, it's not surprising.
This inside source worked at Regional Medical Center. The person is speaking anonymously because they're still in the industry. As a coordinator who had direct contact with the facility's morgue, they say for years they witnessed these problems at least several times a month.
We'd have 6 bodies and only 4 refrigerators. The transport orderlies would have to go out and rotate the bodies because they have to be kept at a certain temperature. Otherwise, bodies melt.
So you'd have 2 just lying outside a refrigerator?
Correct.
Is that supposed to happen?
Nope. They're supposed to be kept at a certain temperature level.
What's the worst thing that you saw with this problem?
Melting bodies.
In the months we've been reporting on HCA, Good Samaritan, and Regional, officials have never agreed to an interview. In a statement sent Thursday, the hospital spokesperson added, "We simply did not live up to our commitment. We can and should have done better. We have investigated these incidents in detail and, as a result, have instituted a number of changes." In Monteleone's case, the spokesperson says there was a significant delay in the family making arrangements, something Monteleone disputes. And she says, after the fact, she never got a formal apology.
And I contacted the hospital several times and I got the runaround. I left voice messages for whoever I got transferred to, and nobody ever called me back.
What's the bigger issue here, you think?
Just lack of care.
For 3 years now, Monteleone and her husband have held on to this empty urn. They're just now starting to heal.
Me and my husband are now pregnant. Definitely excitement, but it also brings back a lot of memories, and it scares us. We don't want to have this happen again.
People have a right to know.
The spokesperson for Regional and Good Sam says these cases are rare, but admits the hospitals caused grief to the families. She says the cases have also helped the hospitals identify holes in their practices.
Also tonight, a high-level executive is stepping down from Good Samaritan Hospital. This is in the South Bay. The announcement was made this week, shortly after our investigative unit exposed a lot of problems there at Good Sam. Let's bring in our investigative reporter, Candace Wynn, who joins us with some major changes. What's happening, Candace?
Yeah, hey, Raj. The chief medical officer of Good Samaritan Hospital is resigning. We confirmed this today after also learning another executive, an associate chief nursing officer, is no longer at the hospital, too. Now, I want to take you and our viewers through our reporting timeline these last few months. In June, we first reported on concerns of dangerous patient care based on inspection reports and firsthand accounts from nurses working at Good Sam. Then in July, federal regulators put Good Sam's Medicare contract on notice at risk, saying leadership failures put patients in harm's way repeatedly. Then in August, we broke the story that Good Sam and its sister facility, also located in San Jose, mishandled and Raj even lost several patient bodies, which the hospital acknowledged and apologized for. Then just this week, we obtained an internal memo confirming their chief medical officer is resigning after 18 months on the job.
Laundry list we're seeing here of missteps. You've been dealing with Good Sam for months now. Any indication to you that they're just trying to make things better? What are they saying about this resignation even?
Yeah, Good Sam says they don't talk about personnel issues publicly, but they did say the pandemic has made it common for healthcare professionals to reevaluate their priorities and want to be closer to family. And that's what also was said in that internal memo we had. I reached out to the CMO himself today. He had no comment. Now, for months, we've been trying to get those answers, Raj, that you were asking about, these changes, these improvements at the hospital. But rather than speaking with us, they've embarked on this public relations campaign across the Bay Area, recently releasing this pre-produced social media video of their CEO.
I want to be able to reassure folks that we're going to follow through, and that I can be as transparent as possible, talking about the tougher challenges.
And Raj, Good Sam, on top of that, has also taken out a full-page newspaper ad, essentially with the same message and idea there, and that was just last Saturday.
Okay, a PR campaign in full swing, but again, they haven't really necessarily gotten back to your questions that you've been asking them?
They have not. We have gotten statements saying that they are adding nurses, they're adding doctors, they're investing millions to help with patients. So we've had a lot of written reports, but we've never sat down to ask them the questions we want to ask.
I'm sure some of those questions will be answered soon when you keep asking. Thank you. Candace Wynn reporting in our newsroom here. Candace Wynn is out in front of this story for months now. You can see all of her investigative reports on Good Sam, the hospital, on our website. That includes accusations of staff losing and mishandling bodies, as she was talking about. Just go to NBCBayArea.com/investigations.